Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And I would like to welcome Dr. Stephen Palanchuck and Dr. David Hall. Thanks for joining us today, Stephen and David.
Thank you, Kim.
You're
Thank you, Kim,
welcome.
for having us. Good
You're
to be here.
very welcome. And by way of introduction, Dr. Stephen Palanchuck is a primary care critical internist in Canada, the founder of, is it VociNova?
VociNova, yeah.
Yeah, VociNova, the new Voice of Caregivers, and creator of the podcast Healing Until We Break. And Dr. David Hall is a board certified urologist, men's health expert, and wellness coach, helping professionals achieve optimal fitness and health with personalized strategies. And today we'll be talking about how a few months ago, David shared a powerful post about the need to slow down and pause. And that resonated with me. And Stephen came to mind as over the past number of months, he had shared with me that he had to do exactly that. And also, Stephen is building a nonprofit cooperative community of caregivers, which would be awesome to raise awareness about and replicate here in the US. So, as we get our conversation started, Stephen, what would you most like our audience to know about you?
Well, that I'm only human. It's something that we tend to forget as a doctor or a caregiver. But when I want the patients and the people to remember is that I'm only human like everyone else.
That's so true, and so many doctors say that, and you'd think it's a no-brainer, but it's really deep when you say that because it's true. So thank you very much for sharing that. And David?
Yeah, I mean, I totally agree with that, Stephen. I mean, yeah, I think we tend to forget that doctors are human. We need basic things like sleep and food and health as just as much as everybody else. And so
Mm.
I totally agree with that. But yeah, I think I'd like readers, or watchers, I guess, viewers to know that I'm passionate about men's health, as you mentioned. I think especially within men in medicine, I mean, I think we tend to forget about every aspect for health, physical, mental, you name it. And so that's really where my passion lies. So excited to keep pushing that message forward.
That's fantastic. And Stephen, would you like to share a bit about the pause and what that means to you?
Well, taking a break, when there was a pandemic, I was very much implicated with developing some protocols and getting prepared for what we were seeing as a storm coming. We were watching what was happening in Italy, and the emergencies flooded. So I was very much personally and professionally implicated. But that's when I was first burnt down. And then I took a small break. Back then it was only a month to get, centered on my priorities. And I went back. But then I learned that I didn't change much in the way I was living my life and seeing life, itself. And I had lost sense in what I was doing. I had some losses, colleagues who committed suicide, and it was a big eye opener for me because all this suffering that I was trying to hide just came back like right in my face, and it told me that, well, if you don't take the time to slow down, then the life will make it, in your place. So I wanted to stay in control, and to do that, I, made some changes, and I realized that I was not. It was okay to ask for help, and I didn't have to do it all alone. Because I first thought that I should, it was the autonomy that we called. So I had to do everything by myself. And I was the only child, and that's what I was, how I was raised. But then I learned as I grew up that the real autonomy is to know when to ask for help, and that's what I learned. And I wanted to have other people around me, other colleagues, other doctors in my province to benefit from this kind of thinking. And I'm always saying, if you want to have different results, we have to try different things. So that's how I was, interested in the mental health of healthcare professionals and caregivers.
Mm-hmm. Yeah, well, thank you for sharing all that. And David, anything you'd like to respond to what Stephen said, and also about your post about the pause?
Yeah, so I mean, I agree with what Steven said about the pandemic. I mean, I think it changed, pretty much all of us in some way, especially in healthcare. And I think urology was unique amongst some specialists in that we really didn't pause during that time. I mean, cancers, infected stones, people can't urinate, need catheters. I mean, we were just as busy during that time with limited resources as just about anybody. And some specialists had quite a bit time off to just sit at home and kind of relax in a way, but we didn't. Sounds like Stephen didn't either, and obviously a lot of folks on the medical side did not. But urology, was, I think, a little unique in the surgical side to have that just aggressive need for us during that time. And a lot of things did, the elective stuff did get pushed back, but that just created this like massive need post pandemic, and we never slowed down. I mean, I think it just created this like amplified need that just, but no, I think life hit. If you read any of my stuff on LinkedIn, I talk about life's great, but life will hit you. If it hasn't hit you yet, it will at some point, right? I think we all know that. And so I I came out of residency thinking I had to do, I had to hustle, I had to grind, I had to just say yes to boundaries. No, I'm the doctor. People need me. I say yes, right? And so a decade goes by and you start to realize that's not sustainable. And so you start to question like, well, what do I do? How do I change things? And it's kind of like changing a moving train. It's really hard to do. And so it takes a lot of guts, a lot of effort, a lot of support to start rethinking, do things, but that requires either a physical pause or a mental pause just to stop and you, you really want for the rest of your life, because we're, I think, approaching middle stage of our career, and we look back and we realize maybe we didn't do it quite right, but we want to keep doing it, and so we need to change things, and so that requires a pause. That's kind of what I've been doing the last couple of years, is figuring out the next step, next stage, 2.0, I guess. So it's important for everyone to, if they haven't done that yet, do it now. So
Yeah, for sure. And I love, Stephen, the way you talked about asking for help and that you're never alone. If you would like to speak a little more to those things.
Yeah, well, I wanted to also bounce back because we tend to always want to say yes, and I agree with that because well, the demand will be infinite. There's always going to be patients who are going to be sick, and oh, can you see my cousin? Can you see my coworker? Like just another patient at the end of the clinic, and can you see this one more patient? And so it goes on and on and on. So it's on us to respect our own limits, because like I said, we're only human, so we do have to take care of ourselves to be able to take care of others. And being a young doctors, it was also or particular because the models I had were those like older doctors who were very strong, and that didn't need help, and they were there, and other healthcare professionals were underneath, and that didn't like fit with my own values. So I had to develop my own set of values, and that's when I started to realize that I'm just part of, a big team that's taking care of the patient basically. So if the person, that's cleaning the ICU, if this person is not there, then I cannot have patients, coming in. So everyone is important in this kind of chain.
Mhm. I love the way you say that. David, anything you'd like to speak to that? And also, if you wanted to give any examples of what the pause has looked like for you.
Just to rebuttal with the team approach, I mean, I think we're trained to not really think that way. I think within business, maybe they learn teams. I think in healthcare, it's like you're the doctor, like you're it, and that's not true.
So what would you like to share about your nonprofit cooperative community of caregivers?
Well, the idea came to mind first when I started to think about what kind of solution I could offer to better support the caregivers. And so I had this idea based on AI to help, the caregivers to help themselves. And because, the AI is often described as being, your own mirror. When you talk to yourself, you're not really talking to a person. You're more talking to yourself. But sometimes it's good to have some, validation and to be able to talk about stuff that you may or not be able to talk even to your own colleagues or like friends and family. But then as I was developing this platform and this idea, I realized that in medicine we say we cannot offer a treatment without having diagnosis. So I decided to take a step back and to go see the caregivers to ask them, well, what is the problem? Because just, offering a solution might not be enough. And what I discovered in my podcast, speaking.
Stephen was telling us about his nonprofit cooperative community of caregivers.
Yeah, so I was explaining that as I was speaking to people on the podcast, like doctors, nurses, some mental health experts, I realized it's not a problem of knowledge because we know how to take care of ourselves. I mean, we teach it to our patients. So it's not, about the knowledge, and it's not even about accessibility because if I wanted to see a therapist or a psychiatrist, we always have a network of people around us, someone that knows somebody. So then I asked myself, so what is the problem? So people told me that it's a cultural problem. As we were speaking earlier, that doctors and caregivers, we always tend to take care of others before we take care of ourselves. And just recognizing that we have a problem and that it's okay to ask for help and it's okay not to be okay, just that it is a big step. So I realized that the sense of community was a bit lost, especially during the pandemic, because we, have to separate everyone, and everybody was like in his own corner, they're doing their own things. And I realized that if we want things to change, it's not very difficult. We just have to sit in the same room, speak about what's going on, what we, feel these days. And it doesn't take a lot of resources to do that. And yes, developing a platform and connecting people with technology, I think it can be awesome. But just the fact of acknowledging that it's okay not to be okay, and like I see you, I recognize you like as my equal. Just doing that, it's part of the solution. So the nonprofit will be this kind of federation of all these support groups that are scattered around the province in all the hospitals, but they are working on their side on their own. So the goal is to connect those initiatives together until one roof, and to help people like develop new support groups, and give them resources, and give them access to after that therapists if they need it, like through a network. So being a cooperative, so the therapists will be included. So it's for caregivers by caregivers. So that's the whole philosophy.
And I loved it when you shared that during our individual conversation, and you had told me how, like we know what to do, we just have to do it. And
Mm-hmm.
when you decided to pilot your once a month getting together with the doctors and the nurses, and I asked you, if you had checked with administration first, and you were like, no, we just did it, right? That it's
Yeah.
that you could just go ahead and do these things, and it's what, 1 hour a month, 3 shifts a day, and to get all the nurses, and you just talk about things, and
Mm.
I love that. So David, what does that bring up for you, all of that?
Yeah, I mean, it's super important. It's just, like talk therapy in a way, which data suggests is really simple but effective, if it's in a group or even just with a therapist. But I think you're right. None of this is like complex. We know it. It's almost like we need permission to do it, right?
Mhm.
It's if you see me write, I write about I drive my kids to school. I didn't do it for years. It's almost like I need permission to realize that's okay. I can do that. Most docs don't do that, but I can do that. Or people need permission to say, hey, it's okay to go work out at lunch, right? You can go do that. You can leave early on certain days. You can structure things that work for you, and not everyone's the same, right? Everyone has different needs, different priorities, different stages of life. But I think, yeah, talking to others, that's going to be super powerful because getting perspectives from others kind of reinforces like, oh, if he does it, I can do that. That's just like a permission thing, I think. So yeah, I like it. That's great.
Mm.
Mhm. Yeah, that's fantastic. What else would you like to share, David, about your focus on men's health?
Yeah, I mean, I think yeah, a little bit more on the medical side. I treat a lot of low T, low testosterone in guys, a lot of guys in their 30s to 50s, maybe even 60s. Um, and a lot of these guys, they have low T, but they also have all these other issues, right? They're stressed at work, they're not sleeping right. And so that's when you start to get a little bit into more of the wellness coaching and the training. And they're not working out, they're not exercising, they're not really doing anything but work. And they're just
Mm-hmm.
stressed out to the max. And so talking to these guys and saying, hey, I'll treat your low T. Let's get your testosterone normalized the medical way. But hey, let's look at these other things, right? I mean, it's just the same conversation. Everyone needs the same stuff, right? You need boundaries, you need balance, you need to actually enjoy certain things, you need to sleep right, you need to eat right, you need to move. Because the more you do all of those things, you put it all together, it's like all just synergistic, right? So I think a lot of us are having the same conversations. They're just kind of worded slightly different, but the concept's the same.
Mm-hmm.
Like we all need the same stuff. And so I think if we all just keep, pounding that message home, I think we'll all start to hopefully realize it over time. But yeah, it's good stuff. It gets me excited. It's fun.
Sometimes I was in the analysis paralysis, overthinking stuff and wanting to come up with the perfect plan, and read on all kinds of stuff instead of just doing it, and
Yeah.
starting getting into action, because then the motivation will come afterwards. So I was waiting for the
Mhm.
motivation just to magically come down from the sky, but then I realized I just start small, and then after that it becomes easier and easier.
Yeah. Yeah, you're right. Just gotta do it. That's
I
very
love
true.
that. And what
Yeah.
helped you, David, when you said that you were, took a period to pause? Like what did that actually look like for you, and what has helped you?
I mean, I think historically I've always found value in exercise and movement, but over time, I think stress ate into that. I got distracted. I didn't really focus. I just went through the movements, but wasn't really making progress. So that was a physical aspect, but that kind of translated into the non-physical, right? I was going through the movements of my day, and there were a lot of them, right? Clinic, family, and I wasn't really paying attention. I got distracted, and just before I knew it, years had gone by. So pausing just to just to stop and like analyze like how am I feeling as I go through these things? Am I paying attention? How does this interaction make me feel? How does doing this make me feel? Just being intentional about all of this stuff is like if we're too busy, too distracted, we don't pay attention and we miss out on so many valuable um, inputs and lessons and you name it. So I think just the pause for me hasn't been a complete pause, right? I've been working, but I've slowed down. I've shifted some things. I've transitioned some things, and that's allowed me to still get that pause element to focus on um, things I wasn't focusing on for, I mean, 15, 20 years probably. Long time. Yeah.
Mhm. I love that. And I'd like to ask you both about, like, when you said, David, how thinking about how it makes you feel. So a lot of, like Dr. Michael Herschel say, a lot of men don't like to talk about their feelings, or he might have thought I could feel four things like, happy, mad, sad, and angry or something or whatever. And, but there are a lot of feelings, and he actually showed me this feelings wheel that has like many, many feelings
Yeah.
on it. And I
It's
was
huge.
wondering, Stephen, if you've taken some time to think about that and how things make you feel and if that's had an impact on you.
Well, for a while, I was very much disconnected of all those feelings. So it was not about talking about them. It was just recognizing them and just feeling them all together. Because the pain and suffering sometimes we see, and David, so you treat patients with cancer. So sometimes it's very dramatic what we see, and very painful end of life decisions, and sometimes it becomes too much. So my defense mechanism back then was to just shut it out, and stop feeling altogether. And like David said, it's just to like give yourself permission. Like it's okay to feel, and that's when I had my most valuable moments with the patient is when I allowed myself to, to be sad with them. I even cried with some patients when something dramatic happened in their lives because I was there for such a long time. And at first, when we are taught medicine, they say to difference the sympathy from the empathy. So because if you sympathize too much, if you feel too much what the patient is going through, like it's gonna get to you. And I can understand why they say that because in a way, yes, we have to have boundaries and to protect ourselves, but at the same time, we don't want to become, very like robotic. Like as I told you before, ChatGPT can like simulate empathy. So we human have to have the real human touch sometimes, and this human touch will be the emotion.
Mhm. I think that's beautiful. What would you like to add, David?
Yeah, I mean, I think, it's funny in med school. Well, when I was applying for med school, when I went to an interview, and I don't remember what it was, but I remember distinctly someone asked me, how would you define empathy? And I described it and it was correct. But then I got to residency and, they say be empathetic, but then they actually, in the actions, they teach you not to be, right? So that's kind of what Steven's alluding to. We see our attendings, we see everyone else putting up barriers, right? You don't want to feel it is too much, right?
Mm,
I mean, there's a lot of tragedy. Um, but you miss out on so many things, right? So I'd say in the last couple of years, the more I feel, yeah, you cry, you get sad, and that wheel is huge. I came across that in the last couple of years, and I think it comes down to like emotional intelligence, right? Like a lot of
mm,
us, especially guys, don't read these novels or watch these things that maybe our female counterparts do growing up. And so they develop this like intense, immense emotional intelligence that I think guys often lack, right? We don't see it as masculine
Mhm.
when that's a problem. I think it's a detriment to society for us not to have that emotional intelligence. So I think the more we develop that as men, I mean, it's only going to benefit our patients, our families, our children, the next generation. I mean, I think it's super important. It is masculine. Let's
mm.
put it that way.
Yes, I love
So,
this, and I did an episode with Dr. Michael Hirsch and Dr. Todd Ott, and we talked about that and how sometimes it is important to compartmentalize. If you're doing a surgery or running a code, right, you don't want to be feeling all your
Mm-hmm.
feelings.
Mm-hmm.
You want to be
Mm-hmm.
focused on,
true.
but then you need time to decompress and process it all later, and that's the problem if you go years and years compartmentalizing it and never process it all. Well, thank you so much. And Stephen, any last words for your physician colleagues and how our listeners can get in touch with you?
Well, the main point for me was just, open up and talk to your colleagues when you see somebody who's not feeling well or doesn't seem to be okay. Don't stay in your corner. Just go to them, talk to them, open up about yourself. And sometimes we don't want to be first, opening up about ourselves, but that's what I try to do now. I'm opening up about myself, and then people will realize that, well, oh, it is a safe space, so I can, speak up and vent also about myself. And so it's going to be mainly in French. So, but for you viewers, but there's an option to translate the website. The website will be in the show notes, I assume, but it's VociNova.com. And so you'll see all the information about the project of the cooperative and the link also to the podcast.
Well, thank you very much. And I say so often, every time a doctor shares their story, another doctor feels less alone. So each of you, sharing bits about your stories and being, masculine men, I mean, and, talking about these things is very important for your colleagues. And David, what else would you like to share and how can our listeners get in touch with you?
Yeah, I mean, I think overall theme, hopefully you gathered, is just slow down, right? Just slow down, take a look around you, take a look at yourself, just pay attention. And, whether that's your own self and how you're, feeling or responding to your environment, maybe it's a toxic one, maybe you're burned out, or maybe it's a colleague, right? If you slow down and pay attention to those around you, that might even be your colleague. So, I think too many of us we're just going too fast. We're not paying attention, and it's hurting us. And so I would suggest that'd be my advice. Slow down,
Mm.
stay curious, even. Like Steven said, inquire about those around you. Like, how is their day? And don't just take superficial answers, right? Try to dive deeper.
Mhm.
Because not everyone's okay, even though we say we're okay. And so for those of you who want to find me, yeah, I'm on my website's getfitandfine.com, getfitandfine. The social links are there. I'm really mainly on LinkedIn as far as like routine posting. Dr. David Hall, urologist, I think, if you Google that. And then my Substack newsletter is, again, most of it's on life, physician practice stuff as a man, as a dad, as a guy that loves men's health. And then, yeah, hopefully it's inspiring for some people. So
Okay, well, thank you. Every conversation makes a difference, and I appreciate you both coming on to talk.
yeah.
And how I always close the episodes is I say, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients, patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Well, thank you, Kim, for the invitation.
You're welcome.
Yeah. Thank you very much.
You're
Appreciate it.
thank you. You're very welcome.